I'm glad that we could all again assemble to be a part of the Board of Health for the City of Lubbock. We've got several interesting presentations and agenda items today, so we'll just jump right into it. First off, as part of the discussion under 3.3 about what I entitled the Health Navigator Event concerning the Affordable Care Act, Ross Schamberger is here, right behind Dr. Epstein. And Ross, well, I guess just stay right there, it'll be fine. I asked him to come here, and he signed up to speak, and we can ask him questions, but let me give you the premise of what he and I have been talking about and some of the other people. About 3 weeks ago in Dallas, they had a event where Blue Cross Blue Shield and their health department and a bunch of other community agencies and such got together for an informational seminar about the Affordable Care Act. And they had about 10,000 people show up. So clearly there's a need for people wanting information, and even though it's still pretty much a slippery thing to know exactly what's going on, that I think that again here in Lubbock we have the same kind of need. So I'd made a call to Mike Sullivan, who is the CEO of Community Health Center of Lubbock, and we queried about how he thought we would do this. So we're in the early stages, but I just wanted to advise the board of how our goal here is that probably somewhere in mid to late January to have a similar type of event where we'll have Community Health Center of Lubbock, other community agencies. We're going to get carriers to come out. Ross is from the Health Underwriters Association, and the whole goal is just provide information, not to get into the right or wrong of the ACA, but just say this is what it is and this is how it applies. Ross, I asked you when we had first talked out in the hall, can you describe sort of, is there a need for information for the ACA?
You want me to take the podium?
Yeah, if you want to, go ahead.
I'll get up there. Well, thank you for asking me to be here. My name is Ross Schamberger, and I've been in the health insurance business since 1980, so I'm starting to relearn it as of a couple months ago. I thought I knew it, but now I know nothing. So I actually cut my teeth with the Blues, so I'm ex-Blue Cross Ross. So started there for 5 years and then went out on my own. So I'm my own agency, and we don't sell car insurance, we don't sell homeowners insurance. We work with employers and individuals on their health insurance. And then of course employers buy dental insurance and all those things, so we do that too. But we're just being inundated with questions. People don't know what to do. Healthcare.gov isn't working. I've not yet met one person that has gotten all the way through and could apply. I have not gotten through. I've tried because I want to see what it looks like. My understanding is the only 2 carriers on it in our area are Blue Cross and First Care. We work with both of those carriers. A lot of people have the misconception that they have to apply through healthcare.gov, and that's only if you want a subsidy, if you qualify for a subsidy. If you don't qualify for subsidy, you can come to, first of all, you can come to a broker. So I'm here representing the health underwriters, some 50-odd agents in Lubbock that are health insurance specialists. You can go to one of those that has done the certification process, because we did have to do a certification process to be federally approved agents, brokers. So not every person can help somebody through that process. But the thing people don't understand is that they have to do it online. Well, it's not working online.
Would you say there's, if I were to say, are there a top 5 questions that you would say that pretty much float right there?
Number
and
one
you get
is,
every
do
time?
I qualify for a subsidy?
Okay.
Which we can actually figure out pretty quick just by going to, you can go to the Blue Cross website, which is on my website, and click on the link that I have on my website. It takes you right to the Blue Cross website, and once you put in just a little bit of information about yourself, not your social security number or any of those things, your age and your zip code, it'll pull down and say, for family of 1, is your income below $45,800 and whatever dollars? Family of 2, $62,000. Family of 3. If you're below this amount, you may qualify for a subsidy. And then it comes over and it asks if you want a firm number, check yes, and then when you do that, it says this may take 45 minutes. Well, my understanding is that's not working. Okay. Then it says, but if you just want an estimate, you can come down right below it and click, and in 30 seconds you put in what your income is, and it'll tell you approximately what they think your subsidy is going to be. So that's the number one question, is do I qualify?
Do you think that an event like this would draw support and interest in the city?
You know, you would think so. We have so many uninsureds, but then I've been surprised in the past. The health underwriters has volunteered time to work with the people on CHIP and go in on a Saturday and set up a thing and advertise it to the whole community through many sources, trying to get the people that are not on CHIP that qualify, because there's thousands of them in Lubbock, and we go over there and nobody shows up. So, I mean, a few people show up, but you've got 50 people in there taking their Saturday to do that, and maybe through the whole day 50 people show up.
So the important thing with having a broad base of appeal, that's why we've talked about different community agencies, maybe put a health fair into it. I mean, something to have a draw. I don't know, maybe Waylon could give us a whole bunch of these little basketballs. But so it's something, and you'd be prepared, you would say that the health underwriters be prepared to help us?
Show up, because we've got a community service group that's interested in doing that. Of course, people don't understand, as a broker, I can help you get your subsidy. I still get paid. A lot of people, the thing that you rarely read is when you start talking about healthcare.gov, they rarely mention that you can go to your local broker and buy this coverage. And then if you ever have a problem, you can go to your local broker for help, or you can buy it through healthcare.gov and I guess call an 800 number to somebody and whoever. Yes, ma'am.
If somebody goes to the Blue Cross Blue Shield site that you have, do they have options for other companies, or does your site only give them the Blue Cross Blue Shield product?
First of all, there's only two choices on healthcare.gov, and it's First Care and Blue Cross. First Care made a not good decision. They're trying to correct it. They originally said they were only going to be on the federal website, so that you would have to go to healthcare.gov to buy First Care. Well, it's not working. So is anybody buying First Care? No. So about 2 weeks ago, they said, we better go put a link up there so you guys can go directly to our website and buy health insurance, because we've got the rates. And I've got the plans with First Care, but they didn't even come out with a paper application because they thought everybody was just going to go to healthcare.gov and do it. So, a tactical mistake. So they're telling us last week that they'd have a website up and working this week, a link.
Okay.
I've not seen it.
Okay, so the difference between going through you and going, if the healthcare.gov site worked,
yes,
people could duplicate that, but only if they had a list of all the companies that provided it. And then they could go to each individual company's website. Now, when you go to but those don't provide comparisons between plans
between the two, no.
that the central site would. So
Yes.
This is an illustration of what Blue Cross Blue Shield can provide.
Right, and what we've told First Care we want. I took them, we had a meeting at my office and with First Care, and I showed them my website, and I said, now when you click on this, get an instant quote here, I want it to pop up and say, here's Blue Cross, here's First Care. So people can go to my website and pull up both plans. And then they call us and say, okay, now explain the difference between these two. There's 5 choices at First Care. There's 15 choices at Blue Cross. So, and there's all kinds of different plans. There's HSA eligible plans. There's high deductible, low deductible. High deductible in the term of $6,000 because that's as high as we can have now. So people need help understanding the difference in the concept of HSA, which I'm a big believer in. So we're there to help people pick either, because in my office we actually have about an equal amount of business with First Care as we do with Blue Cross. So it's really, we just explain it, look at the rates, and then let the people choose what's theirs. I don't ever tell somebody buy this plan. I explain the differences. It's their decision as to which plan to buy. I just make sure I explain them correctly, and then they go from there. So we're hoping that maybe next week we'll have First Care's link working. They'll have a paper application. Today for healthcare.gov, I just finished this morning helping a lady complete her 8-page healthcare.gov application. And all it does is find out if she qualifies for subsidy. It doesn't even pick a health insurance plan. There's no place on that to say, I want this health plan. So that all it's going to do is tell her you get the subsidy, and then she still has to come back and apply for that health insurance separately.
So clearly, the idea of an informational seminar after, if we wait 6 weeks or so, maybe it'll be kind of shaken out. Okay.
Yes,
All right.
absolutely.
How many people in Lubbock County are uninsured with the estimate?
Well, statewide it's 40%, so I'm going to guess we're probably right there, mirror there.
40%.
Actually, it's a little bit higher if you break it down by ethnicity. Among Hispanic communities, about 60%. If you go out into rural, it gets higher, but 40% is a safe estimate on uninsured.
We're the most uninsured state in the nation.
We're up to 40% uninsured. I thought we are around 28, 30%. When did we go to 40? Wow.
I'm picking up on figures that I get off of the news.
Is that the number you have?
Yeah,
Wow.
it's gone up.
If I'm incorrect, I learn new things
Well,
every day.
it's bad.
And
Brian,
so,
the one thing I want to tell you, go ahead, I'm sorry.
well, I just, along that train of thought, so Texas is the most uninsured. So all of these uninsured people still get sick, still need medical care, so they've all been going to ERs. So in the long run, the cost of the insurance program should offset the ER.
Right.
I know it's
Now,
not apples and oranges, but
some of these folks obviously qualify for Medicaid, but even there, my understanding is there's a big percentage of people that would qualify for Medicaid. They've never actually gone and signed up.
Right.
Just like on CHIP. We've got thousands of kids in Lubbock that qualify for CHIP. How do you get those parents to come in and sign them up? All they had to pay was $10 a month. But maybe they'd just rather take them to the ER and the ER write it off.
All right, Kay?
I would say that you use the old health education way of doing it. You go to the churches, and that's where you would get the support to bring in the uninsured.
Good point. All right, thank you, Mr. Schamberger. We'll just stay tuned, everybody. I wanted to introduce him and let you know that Mike Sullivan and I and his group are going to be talking some further about this. We'll have more information at the December meeting and hopefully get something set up going in late January to both provide information and some clarity as we get it.
Yeah, I think the broker community would really appreciate people understanding, because most people don't realize that brokers are still part of the solution, and that the plans that you buy from Blue Cross or First Care, they are identical in benefit, they are identical in cost, regardless of whether you buy it direct from me or if you buy it online, direct from the carrier, or online through the new marketplace, healthcare.gov.
Okay. All right.
But one thing I want to tell you, Minnie, I'm a physician. This Obamacare is complex. Even as a physician, I have a hard time putting everything together. And I talk to some of my patients, and it's complex. As a health board, I really think we have a responsibility to bring it to community, to serve the community. Bring some event like this. I don't know the structure of the event. Bring whatever we can bring, so we can educate the people so understand and make it simple so they can figure out what they need to do. Because Obamacare is meant well. I think the purpose is the right purpose, but it is complex. And I feel like we have a responsibility to make it simple and explain to our community. And if we take this community or more events, let's do whatever it takes.
Okay.
Ross, what, just on the propaganda side of the things that we've heard about the premiums being so much more expensive than people's personal health care that they have now, is that true or false?
That is true, especially
For
more so
comparable
for the young and the healthy. Because if you don't mind, I'll give you just a quick, this is the Ross Schamberger version.
Okay.
Today, of course, when you go to buy an individual policy, they have the right to just exclude you. Or they could put exclusions on certain conditions. They'll say, yeah, you're covered for heart attacks and car wrecks, but that knee that's already shot, it's not covered. Okay? Well, they can't do that. But in today's world, a guy that's 64, his rate is about 5 to 6 times a guy that's 21. Under Obamacare, it says you can't charge this guy more than 3 times what you charge this guy. So what do? Get them closer. What happened to this guy? Well, this guy didn't want to buy it when it was $100. Why does he want to buy it now that it's $140? And then they say, oh, we've got the guarantee issue, everybody, so we have to build that into the system. So that's going to make the rates 20% higher. So then they just do this. So now this guy's back to where he started. This guy's 60% above where he was. So now the young, healthy are saying, I don't want to get into this deal. And that's going to totally throw off the whole concept of everybody get in it and pay money into the system to cover the claims for the sick, because the sick are going to get in it. But the young, healthy ones are staying out because we just drove their rates to the ceiling compared to where they were.
So there's a component also that fines you for not being part?
Yes, but it starts off the first year it's $95 or, and people don't hear this, or 1% of your income up to a maximum of $285.
Oh, it's limited to
The first year it is,
Yeah.
so people are going, oh, I'll just pay the penalty. That's less than 1 month's premium.
But hopefully we'll have, in a month from now, we'll have some better clarity about a lot of more of those
Yeah,
issues.
yeah, and then after yesterday, they just took the bucket and turned it upside down.
Yeah. Okay. All right, stay tuned. Thank you, Mr.
Okay,
Schamberger.
thank you very much.
Okay. So we'll just, that was kind of 3.3, so we took a little bit out of order. Now we've got Mr. Michael Summers is here from Wayland Baptist. This is somebody that Ollie had found for us to talk about the program that they've got up there in civility and matters of public debate. So I'll turn it over to Michael. Go ahead, sir.
Well, thank you for letting me be with you today. Dr. Arm sends his greetings and his apologies that he could not be here. But I never go anywhere without taking Wayland paraphernalia with me. So you've got a folder with some of the updates on Wayland. In there is a little thing saying some of the highlights from last year and other things. You've got a ball. Please do not be uncivil and throw it at somebody. And,
Now you're taking all the fun out of it.
that's it.
I
And
got
then
an autographed ball by Marsha Sharp, so that
Yes.
this will go.
That will go great with that. And then, but civility at Wayland has been something we've been working on since fall of 2012, with researchers showing that adolescence is now extending all the way up to age 30 in some cases. That's scary. I was writing some things this morning about that, and 30 years ago it was pretty cut off, 18 to 22, maybe 25. Now studies are showing it may not be over till 30. Somebody said, you know, my 20-year-old daughter is very much like Jesus. Didn't do anything till she was 30, and if she worked, it was a miracle. I don't know how true that was, but that came from a pastor, so I have to give it some truth. But in the fall of 2012, with the media saying that this was the most uncivil election we'd ever seen in the country, Dr. Arms, our president, addressed that issue in convocation and just put out the question, what does it mean today to be civil? How do we teach each other to be civil? And so we started a conversation with our staff, our faculty, our administration, our students. That fall, we had faculty groups, we had staff groups meeting, trying to wrestle with that. In the spring of 2013, we had campus discussions. We took one chapel and just broke everybody into small groups with faculty, staff, student, organizational leadership leaders, and then randomly chosen by the number which group you got in, and did nothing to talk about civility that day. The results of that were that with our civility committee, we came up with a statement of civility that you have there in your 2 handouts I've given you. And it is from a Christian viewpoint. We are a Christian higher education institution, and so we'll reflect that in our statements. We've got some scripture references as well, but it is a statement of civility that would stand out even if you just took out some of those statements and didn't make it religious in nature or cause. That was approved last spring. Since then, it's been approved by the cabinet and by the trustees, and is the follow-up document to the other one that you have there, which was our statement of diversity, another issue that colleges are wrestling with these days. That was approved last fall in October of 2012. Together, these have now made the basis for us to go and start a true emphasis on civility. Not just what does it mean to be civil, but how do we implement it? And so this fall, we started an emphasis on civility through professional development, through staff development, and through our student organizations, beginning even with orientation. And that emphasis is here in this banner, and I'll stick it here so you can see. And with that, we took 3 words for this year: think, or listen, think, and pray. If you were doing this in a non-religious institution, I would replace pray with respond. But the emphasis is, how do we treat each other? First of all, we have to listen to them. We took one chapel just to talk about how to do active listening, how to truly listen to each other first. Most of the time, we don't listen to 70% of what language is, which is body language. We're always listening to see how we can react or reply. And so we talked about what does it mean to truly listen to somebody. Then we talked about think about their point of view, think about their side, their culture, their background. What are they trying to say? Their situation, even the spiritual dimensions of that. And then pray. How do we respond to that? For Wayland, being a Christian institution, we want to consider what would God's response be. But ethically, what is the right thing we should do in any situation? How do we respond, not react? How do we respond, not reply? And so it's getting beyond politics to truly dealing with people on a one-to-one level. From that, we took civility and have expanded it to give some flesh to that bone of a statement of civility. What does that look like? And so you can see those things there: compassion, integrity, benevolence, kindness, selflessness, affability, respect, and decency. And so we have these up around campus. This has been an emphasis. With that, in a generation that is highly visual, we have taken 2 chapels, one in the fall, one in the spring, to let our theater department explore this. And last fall, what the article in the newspaper really dealt with was our theater department's Wayland the Barbarian Part 1. In the spring, we'll have Part 2, but no words, just acting out in the fall cases of incivility. Different scenarios, different settings, where the students could see that. And not just civility not being done among students, but teacher to student, student to teacher, teacher to teacher. All levels of incivility. In the spring, we'll do Wayland the Barbarian Part 2 and act out how to be civil. So the flip side of that. And with that, it has caused all kinds of discussion. So we'll have a follow-up in the spring with small groups again and say, all right, now that we've talked about it, we've defined it, we've seen some examples of it, how do we live it? How do we change our culture? The issues that students are coming to college with today are totally different than 10 years ago, let alone 30 years ago, when adolescence was much less. So how do we do that? One of the things we'll see is those small groups coming about, but one of the other things we'll see is how our student organizations begin to implement this. Because in their reporting, in their SGA network, this will be a part of that. What steps did you take to be more civil, to show more diversity, to show more interaction in your service? And so the program is being fleshed out as we come. We're not talking about it as a program even, it's more of a process. How do we become the people we should be? And how does this relate, how does civility relate to public health? Well, I think that's pretty obvious. Civility touches on employee health, it touches on customer health, it touches on organizational health, it touches on public health in the way we treat each other as a society and as micro-societies within our own organizations. We're already seeing huge differences among student behavior. Perhaps the hardest thing is to get our staff to begin to see civil behavior in a new light. The old TV show, Are You Being Served? That was on BBC. Used to be on public radio here years ago. The whole comedy of that was you had two levels, those in authority and those not in authority, and how they conflicted. We're trying to get that to say you're always going to have some in authority, some who are not in authority, but they shouldn't conflict. They should work side by side. It's coming to a team approach in life as well as in organizational theory. And so those are some of the things we're doing as a university. Lots of testimonies coming out of that. I look forward to the spring when we've seen about a year of this whole process being implemented to see how the students start talking about it. But we're already seeing it in the way they treat each other in the cab, in sporting activities, in classrooms. We're not having teachers having to jump on them for texting during class as much as they used to. But it is something that we have to address today because they're coming to universities without ever hearing any of that. As I start each year with chapel, I have to talk about how do you just behave in a public forum. Whether it's chapel or not, please take your hat off. Please show respect to the speaker. Please listen. Don't be texting, don't be, can we control all that? No, but we can always uphold the standard. And so we're seeing great results already. But that's what Wayland is doing, and we sometimes forget about Wayland because we're just up the road, but we do have a campus here and a great partnership with Tech, and we love every bit of that. So, any questions that you might have?
Have you gotten any pushback from students? I guess I'm thinking that, the perennial problem at Tech football games is the students shouting obscenities during school songs and things like that, and every year the chancellor assigns a spirit committee that doesn't seem to really go anywhere to change that behavior. Either at the individual level or at organizational level, have you found any kind of pushback of, well, but you just don't understand, this is just how we are, or this is our generation?
We have not seen the pushback from generational statements, but from cultural statements. You don't understand my culture. From different ethnicities, different levels of income. But that has been addressed very quickly because most of that came from athletes, and the coaches have stressed this and modeled it. The biggest pushback we've had is trying to get faculty and staff to realize it's not simply about athletes being uncivil. It's about us as well. And so that's been a change of mind shift to say, no, this is not directed to the students, it is for all of us. But as far as individuals, no. Those are dealt with in a very civil manner. Had to sneak that in there. But on a one-to-one, following again conflict resolution models that we find in the Gospels and in other literature. Go first one-to-one, deal with it privately, then work together in a small group if you have to. We have not had anything go beyond that. Now, for other infractions, yeah, sometimes you have those, but those are not civil infractions. Those are true infractions.
I want to thank you and Wayland. It's not just been, and I'm a professor at Tech, so I know exactly what you're talking about. But it's in all of society. It's in the grocery store or in the restaurant that hear 8-year-old kids using foul language that I didn't even hear until I was 20, but y'all are starting something that's fantastic, and I applaud you for it.
And it's better here than in most
elsewhere.
places.
And I want you to have those documents so you can see, here's a model, even if it doesn't translate completely to your setting because of the Christian aspect to it, how can we use this in our setting? But my wife is a high school teacher in Tulia, and she deals with this every day constantly. So,
Are you aware of any other programs similar to this taking place across the country?
we're hearing a lot about diversity programs, but not anything on civility. And so we again are pioneering, that's our mascot, so we're pioneering another area apparently in addressing this issue head on.
I've been in this country about 40 years now. I think we're less civil now over the last 20, 30 years. What happened to us as a society? You have any reflection on that? I mean, this subject is close to me. I try to figure out what happened to us. I don't know what happened. You have any reflection as to why we have become less civil?
in looking at things from a college student perspective in that age bracket, they are faced now with more daily change than any other generation ever before, between technology, between global impact, between economy, healthcare, all these kind of things, but also in their home front. This has resulted in our generations actually shrinking in the way we would do it demographically. When I started studying generational studies back in the early 80s, you could very easily say there were about 5 generations per century, about 20 years, give or take, in each generation. Some educators and researchers are now saying a generation can be as little as 5 years, because the dynamics that shape their life change that drastically over the course of those next 5 years. And so the traditions, the values, the identity that children and students had growing up is being changed at a faster rate than ever before. The breakdown of the home, I think, is an easy one to look at. But what do you do with that? You're not going to get those homes back together or that situation better. How do you take those kids, once you get them to your level, and help them see what it can be? And so civility is a good starting point. But yes, I would agree that we are less civil today than we were at any point in my life.
Thank you.
Other questions? Well, we'll be certainly interested to hear of your follow-up data, because I think this is an evolving, and I'm glad Waylon's taking a look at this, because I think it really, I mean, diversity is one thing, but civility, and particularly as we were talking about the ACA before, we can have policies and laws, but then how we monitor the discourse about that.
Right.
So, all right. See no other questions? I appreciate it, Mr. Summon. Thank you very much. Hopefully you'll get back with us at some point and give us some updates.
Be glad to.
All right. Now we have the refinement of health facilitator job descriptions. Now, did we get those copies to everybody? Everybody got a copy? Okay. Okay. Kay, you took the latest revisions of my revision, so why don't you kind of go through and talk about what our intent was.
Well, I think what we both did was go with Becky's guidance to the job description in the City of Lubbock Human Resources. And we made general changes because, as we had said early on, this is going to be a health facilitator, not strictly a health educator. That this person will be working with volunteers a lot. And so what I did with things that I added in are in bold. Things that Brian added in are in red, I believe. And then there are a couple of cross-outs that I think Becky did. But what we tried to do is use the type of language used in the human resource description. Okay, I can see things that we may not have used the right language. We're not always familiar with that. Tried to keep it general, but this position would be working with volunteers, would be working with the media, with Facebook, etc. And so we need somebody who has those skills and then would possibly be writing grants, etc., but again, with staff. So I think we all tried to put in a little bit of what we saw as necessary in this position.
One of the areas I added on mine was just a category for basic qualifications. I don't know if that's on another document or something like that, Becky, but I added this basic qualifications. So what are we looking for as far as educational level, different types of proficiencies, things like that, certifications. So I added a basic qualifications category to mine. What I did, I moved that part that's talking about, pretty much I changed the language to proficiency in the use of machines and equipment such as computers, standard office equipment, video projector, television, and medical testing films. I moved that line underneath basic qualifications. on that one, and then I'm not sure if we're looking for a high school diploma / GED or a bachelor's.
Online, it says bachelor's degree.
Bachelor's.
Normally, those are pretty standardized things that we do along with ADA requirements of lifting, those things that just are a general part of every job description in the city. For the educational component, it would also contain an equivalent completion of a bachelor's degree in education or a related field, but we also have the equivalency of if you have performed that job for the same number of years and you have experience equal to the number of years it would take to get a bachelor's degree, then certainly that practical experience is worth as much as, but it has to be in a directly related field. Those kind of things come out in those job descriptions as a standard process to give us the flexibility to have a larger group.
Anything else, Kay?
What is the timeline on this, Brian?
Well, as I understood, and maybe Councilwoman Joy can respond, that you guys needed clarification about exactly what we were asking for. So if this clarifies it, and I think that at this point probably the next step is to let Scott take or Becky or whoever take a role at this to make sure the language all lines up, and then after that we'll present it. I don't know that we need to, present it as an agenda item for the City Council, but more of let you guys take a look on it as the recommendations that come off of our city people. And then after that, we're probably talking somewhere in the spring of you guys looking at it and saying, okay, is this something now that we feel comfortable in putting into the budget?
Right. You'll need to be sure that Scott will do this. I'm sure put it in his request.
When would that be?
Budget
In the
begins
spring. Yeah.
Budget begins in February, but the finalization of that process, we have time to work through that to add positions probably through the 1st of June to begin to get those things finalized. At the point that we get this job description done, I still would like to ask the board that we need some pared down goals and objectives of what this person is going to accomplish. What are we going to ask this person to do? And I get that, you want him to be an educator, but we need to have goals and objectives so that if you want them to go, if you want them to pursue the educational aspect of civility, just take that for one broad go. But I would recommend that and we can work with these things throughout, and it can be something that's ongoing. It can be a 1-year process. So we need to know where we want to start so that we can evolve, keep things going. But you have to have things that you can accomplish, or there's too many things, and when you don't have goals and objectives, you get disoriented and distracted, and you don't get much done.
So one example would be, since we're talking about broadening out into social media, that a goal would be the health facilitator would bring to the Board of Health and then forward to the City Council recommendations as to policies and procedures governing the use of social media in the Health Department outreach program. Which would mean they go survey all, because there's a bunch of other websites all across or Facebook pages for health departments, because I've done that before, where they could actually show here are the policies that have been enacted in other
I
municipalities.
think you also have to keep in mind that this is a single person, and you can get stuck on one thing, and if that's what you want them to do for the year, that's fine. But be aware that things with large parameters take a lot of time,
Right.
and you want to make sure that you give things that can be accomplished so that we can keep people employed.
But the idea there would be a timeline there in terms of what we want to generate a document, and this document is going to be generated by this date, over this subject matter.
Sure.
And so
We look to you for the broad goals, and then it's staff's responsibility to work those into dates and timelines to meet your goals.
Okay. So what would you advise as the next step? Do we...
The approval of the job description in its final form.
Okay. So let's set that for the next time. We'll take out these revisions and present it and ask for action on it.
Should I go to human resources and get them to go over it, or should I work?
Becky can facilitate with you to do those things. We can have someone come to.
Face-to-face meeting.
Yep.
So we'll do final approval next time with the, in between, we're going to meet with human resources to make sure this is all workable. Okay?
It'll meet our format.
Right, okay.
I'd suggest even bringing a copy of that format for the board to approve. You know,
Okay.
like in the format that
In its
HR is
preliminary.
using.
Yeah, in its form that then we'll go forward, okay? All right, anything else? Ollie, anything else? Nope. All right. We talked.
Oh, excuse me, if anybody else has any other.
Oh, yeah,
input,
absolutely.
please.
Okay. We pretty much talked about 3.3. Stay tuned. 3.4, Ann Epstein, update on oil and gas subcommittee.
The Oil and Gas Subcommittee has met once since our last board meeting here. We met on October 28th and heard a presentation from Jim Wilkes, who's the president of Texland Petroleum. Texland Petroleum currently operates 1,000 wells across 9 counties in this area. Their primary office is in Levelland. Briefly, Mr. Wilkes is opposed to all the public health recommendations that were made by this Board of Health for changes to the oil and gas ordinance. He stated that his company had brought substantial economic benefits to the city, and he does not think that the type of drilling that he or his company is engaged in, which is conventional oil drilling and hydraulic fracturing, as currently practiced, poses any risk to the water supply or to the public health of the citizens of Lubbock. He did acknowledge that there had been an episode of groundwater contamination in the past that had been due to an accident, but he thinks they fixed the problem and it can't happen again.
Any next step?
I missed the good meeting, it sounds like.
Well,
It was quite long.
it was long. Well, as you can see, there is not yet a meeting of the minds on this subject matter. Another.
And aren't you following best practices put
Yes.
out by the oil and gas?
Yes.
Yes.
So I disagreed with Mr. Wilkie's conclusions. There will be another meeting, I believe, December 9th, and we're working on changes to the ordinance.
Okay. Councilwoman Joy, were you at the meeting? Do you have any
Otherwise,
observations?
well, I think what they are doing is bringing in different speakers with different interests. I think they're trying to be fair to everyone and get everybody's side or stories before them. So I don't think they brought them in to say this is it. That it's just another source that they're exploring. It was a very lengthy meeting, but I thought some good information came from it. They had some visuals I thought that were interesting in terms of where the wells were located and some of those things. And so all in all, I thought it was information.
Okay. Any other comments?
I would say keep in mind the Oil and Gas Citizen Advisory Committee is actually another border committee of the city set up much like this one. So if you ever want like copies of the minutes or any of the presentations, that's all open records and you can make that request. Legal actually is handling and facilitating, much like your wonderful staff here, of those meetings, so I can easily get you copies of those presentations if you're interested in the material.
I would like that.
Can you send me an email? I'll make sure you've got a card.
We do
All right.
have public who attend all of those meetings.
I'm sure Mr. Brady would let anybody come.
Yeah. Oh, yes. It's open.
It's open, they can't speak, I think is what you're referring to. But it is open and they can sit and look.
You have to register.
You can let us know ahead of time, and we'll put you on the agenda, much like city council meetings. And if you're on the agenda, you can have the open discussion with the board commission. If you'd like to just show up and speak for the allotted 3-minute time, Mr. Brady actually welcomes that at those meetings. So please feel free to attend and for informational purposes or to give feedback to the committee, because I know that they really want to do a good job, especially when it comes to amendments to the ordinance. So that citizen comment period is very important to that process.
Okay, thank you. All right. Mary, tell us about communicable disease updates.
For enteric diseases, we did have one acute hepatitis A case. This person was not a food handler, and it was acquired outside of the United States. The other enteric diseases were within expected range. We had 2 cases of chickenpox and 11 cases of pertussis, so that's slowing down a little bit, thank goodness. 1 tuberculosis case, 1 West Nile fever, and 2 West Nile neuroinvasive disease. 1 tuberculosis, as I said, 3 invasive strep, 2 were strep pneumo, 1 group B strep, no deaths, and 1 Q fever case. It was a probable case. I don't know where it was acquired. There was no travel involved, so that one's sort of a mystery. And they were all investigated, and we provided education. On the tetanus Tdap, I did not get a good straight answer. UMC Emergency Department gives Tdap. Covenant, it's up to the doctor. They give one or the other. Grace Hospital gives TD because they didn't have any Tdap. So it's going to be, I did not get you an answer.
Thank you.
Okay, but I did try. Kingsport Urgent Care does Tdap, but there have been shortages of Tdap. So if they don't have it, they'll give TD. So there's no set in stone. If you go here, this is what you'll get. Which you probably expected.
But if you come to the health department, you get Tdap.
Yes.
Okay.
If we'll have it.
Yes.
I don't know if y'all get the information, but you know anything about the West Nile neuroinvasive disease cases?
Mm-hmm.
Did they resolve, or are they still ill?
One
Severe involvement.
One resolved and is recovering. The other is deceased.
Because there's a lot of information out right now, and we're hearing more about it. I saw a presentation the other day on increased meningoencephalitis associated, and even poliomyelitis associated with the neuroinvasive disease this year.
The death had quite a few comorbidities, and that seems to be who succumbed to the neuroinvasive. The other person is recovering well.
Virus is changing again.
Any other questions?
The other case was not elderly.
The one that recovered is in.
That case was a bit unusual that it sort of had delayed onset, early symptoms resolved, and then sort of a rebound, worsening of the individual's symptoms.
Okay. All right. Then on appointed and nominated committee for 2014 chair and secretary, how do we do that? Ms. Baker? All right, I forgot. Do
You
we?
nominate 2 people.
2
Be your
people?
committee.
You appoint 2 people?
Yeah. Yeah.
Any volunteers? Everybody's putting their hands in their pockets.
I'll volunteer for the appointing.
Okay.
committee.
Ollie, would you like to serve with Dr. Presley?
Sure.
All right. A volunteer. All right. So Dr. Presley and Ollie Thomas will serve as, and they'll report back at the next meeting.
I was going to recommend Dr. Presley. You already did it.
No, he volunteered.
Yeah.
All right. Okay, and then finally, we need a motion to approve the minutes of our October meeting. Do I hear such a move? So moved. Dr. Cope, second. Okay. All right. So those are approved. Any other business before the board? Even though they're not under our ordinance anymore, I was somewhat disheartened to see that my 2 favorite restaurants this week were the ones that got tagged for critical incidents. So I guess maybe that's why it has that special taste.
Oh.
All right.
Same thing.
Before we close,
Yes,
the nomination committee's been established. Ollie and myself are soliciting discussion. If anyone needs to talk about nominating, providing information, please let us know.
Okay, very good to know. Direct your comments to them. Seeing no other business, we will meet next month. Thanks for coming. All right.
Your favorite restaurant?
Yeah, Nora's on 34th and Quaker. It's just a little dive. It's but they have the best huevos rancheros in the morning.
Oh, really?
And then the other one was George's out on 82nd and about past Milwaukee. And I was watching. I go, well, isn't that something? I said my two favorite breakfast places, and they both got tagged for critical errors. They were correct.
That's disappointing.
But I just kind of went, well, that's typically how it works.
Yeah, they just came in.